My name is Dennis Day, and I'm the physician assistant at Panhandle ENT of Amarillo. These are my supervisors, Dr. Stacy Morgan and Dr. Amber Price. Thank you for having chosen us to serve your ENT needs. I noticed that many of you study the ENT posters once you're in the examination room, and I thought that I'd make a video to explain in the simplest layman's terms two very popular posters found in almost every ENT office. This video is a pilot study to see if you like the idea of watching an educational video before arriving at the clinic. And if you like it, this video might be attached to the BSA Penta website and will be supplemented by others going deeper into each topic. Notice that this particular chart has three zones. The upper zone describes the ears and the hearing mechanism. The middle zone describes the nose and the sinuses. And the lower zone deals with the throat, the tonsils, and voice box and vocal cords. In the next slide, I'll discuss the zone describing the ear. The external ear consists of the ear and the canal up to the eardrum. The middle ear is behind the eardrum and contains three small bones, middle ear. The inner ear consists of the membranous labyrinth, consisting of the organ of balance and the organ of sound. This is the inner ear, which consists of the membranous labyrinth, consisting of the organ of balance and the organ of sound. Balance and sound. The canal produces wax, which helps to keep the skin of the canal healthy. Trying to clean the ears with Q-tips is not a good idea, because cleaning the ears with Q-tips only scrapes away the natural protective oils and waxes and invites bacterial and fungal infection. Often people who have used Q-tips develop a fungal infection of the ear, which can cause tremendous itching and creamy yellow discharge. Behind the tympanic membrane, there are three small bones, the smallest bones of the body, called the ossicles, which transmit the sound reaching the membranes into the inner ear, membrane to the inner ear. Together, the bones magnify the sound 30 times. Any obstruction in the external canal, such as wax, can stop the sound reaching the three ossicles and dampen the sound. This is the organ of sound, looking like a snail, and this is the organ of balance, which looks like three inner tubes placed horizontally, vertically, and obliquely. In between the organ of sound and the organ of balance is a small sac of microscopic crystals, sitting one on top of another, whose position helps us to determine at what angle our head is turned. Patients with dizziness are usually referred to us very early, as the main organ of balance is in the ear. But a sensation of imbalance can also come from medications, the bones, the joints, and even due to blood and heart problems. The middle ear is connected to the nose by means of the eustachian tube. The eustachian tube equalizes the pressure between the middle ear and the nose. In children, the eustachian tube is more horizontal because their faces are more rounded, and this eustachian tube allows infected material to go straight from the nose into the middle ear, which is why we may need tubes to be put into our eardrums in childhood to let the air pressure go in and out from within the tube rather than from within the nose. As we get older, the face elongates and the eustachian tube gets more vertical and longer, and we may no longer need tubes in the ears. This is the zone describing the nose and sinuses. The sinuses are just spaces around the nose, which act like water reservoirs to pump water and mucus into the nose and wash it clean of pollen grains and dust which settle there. There are little openings for the sinuses all along the side of the nose where the mucus comes out. And all this mucus moves towards the back of the nose and down the throat where it is swallowed and is digested by the acid of the stomach. Allergies cause the fluid production in the sinuses to be excessive, and the continuous cascade of allergic mucus down the back of the nose and throat can cause chronic inflammation of the nasal passages and the throat. The presentation of this excessive mucus running down the back of the throat can be that of difficulty in swallowing or of food getting stuck in the throat. This is the septum of the nose, which is right in the middle, and this is the side of the nose. Notice that there are three flaps on the side of the nose. These flaps are called turbinates and serve to warm and moisten the air, which we breathe in. In allergies, all these turbinates are swollen, and this causes the feeling of constant nasal congestion. The partition in the middle of the nose is called the septum. In about 80% of the people of the world, this septum is bent at an angle or has a definite curvature, and this phenomenon is called the septal deviation. This can cause recurrent epistaxis, that is bleeding from the nose. Air does not flow completely straight down the nose as it should and goes round and round in eddy currents where the deviation is, and this dries out that area quicker. The mucous membrane, that is the skin covering the septum, gets thinner, especially in places where it is stretched, and this thinning causes the skin, that is the mucous membrane, to crack and to bleed. Also note that the nose is connected to the eye by means of the tear duct, which is a drain pipe for our tears and is the reason why we sniffle when we cry. This connection also allows allergies to travel from the nose to the eyes, causing our eyes to itch and become red. The tube connecting the nose to the middle ear, this is the tube, connecting the nose to the middle ear, is called the eustachian tube, which equalizes the pressure between the middle ear and the nose. This is the zone describing the throat. A common reason of why people present to ENT is because of difficulty in swallowing. or a feeling of lump in the throat. There are three main reasons why people may have difficulty in swallowing or may have a feeling of continuous lump in the throat. These are, number one, due to allergies and thick mucus running down the back of the throat and collecting over the vocal cords. Number two, due to acid coming up the food passage and burning the throat. And number three, due to growths in the throat. To differentiate these three, that is, allergies coming down the nose, acid coming up the throat, and growths in the throats, to differentiate these three, we have to use a laryngoscope. This is what a laryngoscope looks like. We first spray up the nose to anesthetize the nose before we insert the fiber optic laryngoscope, which is introduced from the nose down to the vocal cords. We introduce this end of the laryngoscope down the nose and up to the vocal cords. This is about this distance is about 6 inches only, so nothing to worry about. This is what the normal vocal cords look like during speaking and during breathing. This is a vertical, that is coronal section at the level of the vocal cords. This chart is a little involved, a little complicated, but it is best suited to explain the problems of the ear. Notice that the inner ear, also known as the membranous labyrinth, has two parts: a coiled snail-like structure called the cochlea, which is the organ of sound, and this structure, which looks like three inner tubes placed at right angles to one another, called the semicircular canals. This area is called the vestibule. The whole system of the vestibule and the canals is called the vestibular apparatus. There is fluid inside the entire system. The pink area that we see extending all around the cochlea and in the inner three semicircular canals and in the three semicircular canals is actually an inner chamber, this pink area, which extends all along the cochlea and the semicircular canals and is known as the middle compartment, in Latin known as scala media, the middle compartment. See, the pink area is magnified here, and this is the middle area, the scala media. Sound reaching the tympanic membrane is transmitted to the membranous labyrinth by three ossicles, that is the bones of the middle ear, which attach to this area of the labyrinth called the oval window. This is called the oval window. The sound waves hitting the oval window causes the fluid in the system to vibrate. In the cochlea, the vibration of the fluid stimulates the ultimate organ of hearing. The ultimate organ of hearing being, within the scala media, these inner hair cells. The inner hair cells is where, see the inner hair cells here and much magnified here. The inner hair cells is where kinetic energy is converted to electrical energy. Kinetic energy from sound waves hitting the membrane, transmitted by the three ossicles into the scala media. And these inner hair cells are where this kinetic energy is converted to electrical energy. And this electrical energy is transmitted to the brain by nerves, the acoustic nerve. Now let's discuss the lower half of the chart. Our next slide will be on the lower half of this chart, where all these organs of balance and organs of hearing are described in detail. The swellings at the ends of the semicircular canals are called the ampullae. Ampullae. There are little bud-like structures called cupula here, cupula. Inside the ampulla, which move to and fro when we move, letting us know the position of our head and body. In between the cochlea and the semicircular canals is a sac full of crystals. The sac full of crystals. These crystals move as we turn our heads, and information regarding the position of the crystals is transmitted to the brain. Here you see the head moving, and note how the crystals change position as the head moves. These crystals are embedded in jelly, and as we get older, the jelly tends to dry out and the crystals can roll away into the different semicircular canals, causing vertigo and dizziness. This phenomenon is called BPPV and can be corrected by certain movements of the head called the Epley maneuvers. In Meniere's disease, let's discuss Meniere's disease. The pressure inside this middle chamber increases, and this increase of pressure inside the middle chamber is transmitted to the inner hair cells through the pink middle channel. Pressure is also transmitted backwards to the vestibular system and to these cupula and the ampullae and these crystals, causing disorders of balance, dizziness, and giddiness. As the pressure on the hair cells in the inner ear increases, deafness and ringing in the ears occur. And this can fluctuate as the pressure inside the middle pink compartment, the scala media, fluctuates. Why do we tend to lose hearing, especially higher frequency hearing, after around the age of 40? The higher frequencies are that frequencies at which our womenfolk and children speak. And then this causes them to think that they are being ignored. Notice that the cochlea is shaped like a pyramid, like a snail shell of 2.5 turns. The highest frequencies are heard at the base of the cochlea, shaded in yellow. The middle frequencies are shaded in green, the next turn, and the lowest frequencies are shaded in blue and white, the top turn. Because the base of the cochlea is sitting in close contact with the bone of the skull, the shocks from the head are transmitted first to the base of the cochlea, where the highest frequencies are heard. And this is thought to be the reason why we tend to lose high frequency hearing first. Sound is finally actually deciphered and understood in the brain. Nerve fibers from each side go to the opposite side of the brain to an area called the acoustic imaging center. This ends my little explanation of the ENT charts in the simplest non-scientific ways I could think of. Please do have a look at this video before arriving at our office, and feel free to question us regarding this video once you're sitting with us in the clinic. Thank you so much. Have a great day. Bye-bye.